you doing, everybody? John Desai, OCBody.com. Just had to make a comment on this one. Couldn't let it go. I'm in Orange County, California. I've been doing plastic surgery for 12 years. The lady that made this statement here is talking about saline-filled implants. And I've got a pretty good experience putting breast implants in and taking them out too in people that want them out. And people that have problems with breast implants tend to have this, a silicone gel breast implant. They don't tend to have the saline-filled implants. Saline-filled implants, in my experience, have been pretty safe. I still encourage my patients to have saline breast implants. I discourage the silicone gel, except in the ladies that say, hey, listen, I understand the risk and I'm willing to take it. I've seen patients like the lady here who say they've had problems or who've experienced problems in the way of lupus and collagen vascular type diseases. That's what those diseases are called. But I've not seen a single patient with that kind of problem that had saline implants placed. They're all with gel. And I've seen a couple people who thought saline implants had caused a problem, and some of them ultimately had the implants removed, and they didn't find the problems changed. So I think the bottom line on this one is, if you're going to consider breast implants, you need to do your research. Everybody should do a research. And if you're going to have silicone gel implants, probably much more important that you do that research, because you're accepting some degree of risk. And it doesn't happen to everybody. If you have silicone gel breast implants, your biggest risk over the long term, your most likely big risk over the long term, is that the implants are going to get hard on you. And that happens much more commonly than with the saline implants. But with saline implants, as long as you don't go really large and you have adequate tissue to cover them, you tend to do pretty well over the long term. I've got patients who've had their implants in over 10 years. I don't recommend any routine replacement, I should say. They don't have to come out unless there's a problem with them. And they've predominantly stayed soft in cosmetic patients. Reconstructive patients after cancer, a little bit harder group of people to deal with implants in general. But, take what this woman says with a grain of salt. I'm not entirely sure what exactly her situation is. But the minute she said that her problem was with saline implants, I have to disagree, at least with regards to the overwhelming majority of people for whom I perform surgery. The saline implants have been safe. So, do your research.